in the reproductive process, I think is a conversation that is worthy of note. 19 years of general medical experience, 5 years of specialty training in obstetrics and gynecology, and definitely here with a passion to help patients. Thank you for being here.
Good morning. Thank you very much for having me.
It is a pleasure to have you. So we think as a society that it's important for the male partner to also involve themselves in the process of conception, reproduction, and everything there is.
Okay, thank you very much for the question. So it's actually important. The role that the partner plays cannot be underestimated. Yes, so male partners have a role to play in pregnancy, in helping the woman, because it's been said from research that even when the male partner is involved, it helps to reduce the complications of pregnancy prenatally and within the pre. Cannot just continue to have this misconception that when a woman gets pregnant, it's all about the female. Now, yes, it's true that the society has this notion that when a woman gets pregnant, that it's all about her. Now, one of the things, the benefits, okay, that can a male, the female can benefit from, can have in this relationship is that when a male partner is involved, okay, there is it helps the woman to have better access to the healthcare. Because when she's motivated, even when she doesn't feel like going to the hospital, the male has an influence in motivating her. There's communication between him and the female, and they're able to make decisions together in order to visit the hospital. And so when the male is involved, it motivates the woman and morally, and the man also gives his own financial support in helping the woman to have access to this healthcare.
For the prenatal experience, what is the significance of the male partner involving themselves in prenatal care? Also, we abdicate that responsibility to the doctors. Just go to the hospital, let them examine you. That's what we think. So what is the significance of the male partner in prenatal care?
Okay, so the significance of the male partner there is that now, if you were to remove the male partner from there,
right,
then you will see that there will be a lot of isolation. The woman will not be able to have that care, as it were. But when the man is involved, you see that there's a lot of emotional support. We can even grade them into probably about 4 categories.
Okay.
There's emotional support, there's a practical support, there's the health outcome which the woman will benefit from, and then there's the relationship benefits. Okay, so when there is this emotional support, there's reduced stress for the woman, and there's increased bonding between the male and the female, and even with the male and the baby that is just being expected. Okay, and then also there is also the practical support that the man can give. That's the significance. The man shares responsibilities, even household chores can be done by the woman and by the man in order to help to relieve the woman of some of this. And I talked about financial support initially. And then the health outcomes is that there's increased access to prenatal care, reduced complications, and then even postnatally, the man helps the woman to take care of the baby better, encouraging her to breastfeed, for instance. And then this strengthens the relationship between the man and the woman, and between the man and also the growing baby or the child. And there's increased communication. So the significance cannot be overemphasized.
If you're just joining the program, this is Health Plus on Milan 98.3 FM. I'm here having a conversation with Dr. Chinedu Anumi, obstetrics and gynecology, Maternal and Reproductive Health Collective. We're talking about the male partner involvement in prenatal care, the benefits, the barriers, and the strategies for increased engagement. So let's talk about the barriers. What are some of the barriers? What are some of the societal norms, probably religious beliefs, amongst other things, that sort of prevent men from being able to properly cater to the needs of their wives or their partner whenever they're pregnant?
Thank you very much. This is a very important question, because when we know the problem, then we know what to solve. Now, the barriers now, you can group them into societal factors, you can group them into healthcare system barriers, and even the personal barriers that has to do with the male partner himself, and also relationship barriers that occurs in the dynamics of the relationship. So having grouped them like that, the societal cultural beliefs barriers can come in terms of traditional gender. In this society and many others, we tend to see the male as the main figure, whereas the woman is relegated to the background, and every other thing that has to do with the pregnancy is left to her. Cultural beliefs have contributed much more negatively than positively.
More like, I've given you money to take care of yourself. Why do you need me to hold your hands at the hospital?
The healthcare system also plays a role. So I talked about the healthcare. Now, many institutions actually do not make their environment friendly for the males. So you see the women come alone for antenatal. If you go to many facilities, you see them going alone to facilities. But when men are encouraged to go with their partners for antenatal, it encourages them, it encourages the women. But we'll also come to some of those barriers that deter the men from attending this antenatal. For the woman to do her antenatal, this kind of thing. And then the personal barriers, this could be intrinsic, this could be just inherent with it, like fear. And then I guess, or the whatever the relationship is, whether it's a marriage or maybe they're trying to get married, it could be unstable. There could be some dynamics that could also influence the role the man plays in this. Okay, so as healthcare professionals, what do we need to do? Because it's best to get information from those who are experienced. So I think that void. A lot can be done. A lot. I can enumerate them. Right. Now, the health care providers have a lot to do. Number one is that we leave to the female, to go on with this. The male has to be actively involved, informed, and then how do you do this? They need to be, continually retrained to know that these things are important, inclusive process for both the male and the female. And then another thing is this: the male offer the antenatal clinics during weekends, and they do that for be kept abreast with what is happening during the antenatal, and then connect providers can do in order to ensure that the gap is bridged. What about campaigns, peer support group? I know that there's usually couple orientation that would also help to ensure continued education to the male partner in this case. Oh yes, that cannot be overemphasized. The role that it plays is that men are usually motivated to do it. So that group, that connectivity helps in motivating them to do it. But when it's isolated, you need a lot. It's like climbing a mountain. You can feel out of place if it's the only one, right? So when there are these groups and networks that can be made for men, even it has to Nancy, and then give them some updates, prompts, in order for them to know that yes, these things, the woman, how many months or weeks has your wife gone in pregnancy, and the woman actually will feel much ended when she knows that. This is compound. Now you're pregnant, you don't want to get out of bed, you are just being lazy. Notions and misconceptions like this one. How do you? Men should not say to women. Men say that. I can assure you, they say that. I can pick up about 5 or 6 things. You can't see a woman and say, "Why are you slow?" Right. Or why do you keep trying to cannot help? So a man has to be supportive. So there are some things that you don't happen when a woman is pregnant, that she may be making sure that a woman is up to par with these things. Fix her nutritious snack, get her fresh fruits, vegetables, accompany her during walks, help with household chores, read books in pregnancy, even talk to the baby. Trying to keep her away from family drama. Right. These are the things that a man should do, to protect the woman. Talking about male partner involvement in prenatal care. If people would like more information, I know that 30 minutes is not enough time, or 15 minutes rather, it's not enough time to really go through this very important subject matter. If people would like to get information, talk to a professional, or maybe even have access to programs that talk specifically about this, how do they reach you, or how do they reach the program or the Reproductive Health Collective? They've been very much present when it has to do with maternal health, and this is one organization that should be given a lot of quality and have a real impact on the lives of the communities as well. So it's something that they do. It will encourage the health. Is there a website or social media platforms? What are those platforms so people can check and read something? Yes, it's www.mrhcollective.org. Okay, www.mrhcollective.org. Yes. That's the website. It's the social media, Instagram, because young people like me, Reproductive Health Collective, exactly. MRH. Exactly. So check that on social media. Most organizations, their names are their social media handles. If you would like more information, on that website, is there access to
speak to a person, because most women would not talk to a machine, so to speak, until they hear the voice of maybe another woman or healthcare. So is on that website. So www.mrhcollect. Dr. Chinedu, what would you say to every man who has a partner that's probably pregnant or just had a baby or is about to have a baby? What is your final word to them?
My final word is just be part of the pregnancy. Feel the pregnancy, know the pregnancy, and share everything that the woman is sharing as part of the pregnancy. Be like as if you are the one that is carrying that pregnancy. So whatever you can do to help the woman, it will really go a long way in reducing a lot of complications prenatally, intrapartum, and postnatal. Thank you.
All right, I understand. And I know this is a very touchy subject for some men, because some women, when they were pregnant, they showed their husband shaking. That they said was and also feel the things that she's experiencing. Dr. Chinedu, thank you so much for being here. Dr. Chinedu Anumi is obstetrics and gynecology, maternal and reproductive health cares, and how we can actually fix this particular problem. Thank you so much for being here. And this is how we are going to close the conversation on Health Plus. It's been very insightful talking to you all morning. I'll take a break so that we can usher in our Muslim brothers and sisters for Ìlànà Islam here.